Hello and welcome to English Bulletin of IPR Department. I'm cheering Eden. Let's look at some of the news making headlines. As per the latest update on COVID-19 figures provided by the State Health Department, a total of 19 positive cases were reported on Sunday. This takes the total active cases to 567, total cured and discharged to 1,505. Cumulative total stands at 2,086. A total of 45,075 tests have been conducted so far. Among the new positive cases, a 2-day-old baby has become the youngest person in Sikkim to test positive for COVID-19. The baby has been admitted at the pediatric ward of STNM hospital. The mother had also tested positive a few days back. The state also recorded 3 new casualties, taking the total death toll to 14. A 61-year-old female resident of Shantinagar, Sikkim, passed away Sunday morning at STNM hospital. She was suffering from respiratory and liver problems. Second death reported was that of a 68-year-old male resident of Bojoghari. He was undergoing dialysis and was admitted to STNM hospital on 6th of September. Similarly, the third death was of a 42-year-old female from development area Gangtok, also a dialysis patient, and passed away at STNM hospital on Sunday evening. India on average has been reporting at least 1,000 new deaths daily due to COVID-19 for the past 3 weeks now. With 1,138 new COVID-19 deaths reported from across the country on Sunday, the total number of patients having succumbed to the viral infection in the country has reached about 80,000 in the past 6 months. Maharashtra continues to report maximum number of COVID-19 related deaths in the country, with 416 patients dying on Sunday alone, taking the total number of deaths in the state to 29,531. On Sunday, 93,214 new cases were reported from across the country, taking the total number of COVID-19 positive cases in the country to close to 5 million. Most people in India understand and speak in Hindi. Though it is not the national language, it holds the place of one of the official languages in India. It is also the mother tongue of most of the people. To celebrate the importance of Hindi, a language that resonates with most of the North India, Hindi Divas is celebrated on 14th of September each year. The day is marked on this day as it was on September 14, 1949, when the makers of Indian Constitution decided to designate Hindi as the official language of India. The day marks the importance of this decision and aims to propagate the use of Hindi language in day-to-day life. September 14th also marks the birthday of Bihar Rajendra Sinha, who is also regarded as the main person behind making Hindi the official language of India. Union Home Minister Amit Shah was admitted to Delhi's AIIMS last night, nearly 2 weeks after he was discharged from the hospital. He was earlier admitted to the National Capital's top hospital for post-COVID care. The 55-year-old BJP leader had tested positive for coronavirus when he was taken to private hospital Medanta in Gurgaon. On August 14, he had tweeted that he would be in home isolation for a few more days on the advice of his doctors. He left the hospital after 13 days on August 31st, after the doctors said the Home Minister had recovered. The official statement from AIIMS says that he has been admitted again for a couple of days only for a complete medical checkup before the Parliament session begins. The monsoon session of Parliament has begun today amid the coronavirus pandemic. The 18-day Parliament session is scheduled to be held between September 14th and October 1st. Monsoon session in Parliament is usually around mid-July. The Rajya Sabha function timing is 9 a.m. to 1 p.m. The Lok Sabha will function from 3 p.m. to 7 p.m. Only on the first day, the Lok Sabha will meet in the morning session. Earlier in the run-up to the session, over 4,000 people, including MPs and staff, have been tested for COVID-19. Most parliamentary operations have been digitalized, entire premises sanitized and doors made touch-free. The first of its kind monsoon session will see Lok Sabha and Rajya Sabha sitting in 2 different shifts, while special seating arrangements have been made for MPs in adherence to social distancing guidelines. Barring on the first day, Rajya Sabha will convene in the morning shift from 9 a.m. to 1 p.m. and Lok Sabha in the evening shift from 3 p.m. to 7 p.m. The chambers of both houses along with their respective galleries will be used for sitting of the members in each shift. In between the 2 shifts, the entire complex will be sanitized. Union Minister of Health and Family Welfare Harsh Vardhan on Sunday claimed that India shall have a vaccine ready by March 2021. He even offered to take the first shot himself for receiving COVID-19 vaccine if people have any trust deficit. Harsh Vardhan, while interacting with his social media followers using his Sunday Samvad platform, also informed that while no date has been fixed for the vaccine launch, it may be ready by the first quarter of 2021. He stated that the government is taking full precautions in conducting the human trials of the vaccine, and the National Expert Group on Vaccine Administration for COVID-19 under the chairmanship of VK Paul member Niti Aayog is drawing up a detailed strategy on how to immunize majority of the population. He assured the vaccine will be first made available to those who need it the most, irrespective of their paying capacity. Further, he said that the government is considering emergency authorization of COVID-19 vaccination, especially in the case of senior citizens and people working in high-risk settings. The Ministry of Health and Family Welfare stressed on ayurvedic intervention to manage post-COVID conditions in its latest guidelines issued on Sunday for recovered patients, including use of Chyawanprash and Ayush medicines. In the guidelines, the ministry recommended the use of immunity-boosting medicines like Ayush Kwat and Samshamani Vati on a daily basis for effective recovery from post-COVID health conditions. In the clinical practice, Chyawanprash is believed to be effective in post-recovery period. A ministry advisory said while listing yoga, pranayama and daily walks among the other suggestions. At the individual level, the ministry advised people to strictly follow protocols like wearing face masks, washing hands, maintaining social distance and other respiratory hygiene. It also suggested involvement in regular household chores if health permitted, and professional work should be resumed in a graded manner. Stressing the need to self-monitor one's health at home, the ministry advised recuperating persons to check body temperatures and blood pressure on a regular basis. It also asked them to take oxygen readings on pulse oximeters on the advice of doctors. At the community level, the ministry advised for spread of awareness by recuperating persons about coronavirus by sharing experiences with friends and relatives and through the social media. Besides, the ministry advised for mental health support of community-based self-help groups, civil society organizations and qualified professionals if needed. That is all we have for today. Please like and follow our Facebook page, that is Government of Sikkim, official page for the most authentic news and information on recent developments in the government and the state. Thank you for tuning in.